My presentation is going to be about the project More Air. So I'm a PhD candidate in data science, and I work within the More Air project, which has started in 2017 and still ongoing to this day. It is partially funded by the Belgian ministry through the Filière UOS program, and is under the principal investigators, Professor Mounier Roro and Professor Sophie Pauling. So the More Air project is actually a good presentation of how AI can be used in different fields. Because this project here, as you can see, works on the data acquisition, works on urban pollution monitoring, and also works on the impact of urban pollution on infants' health. My main part of the project is spatiotemporal forecasting, using actually different things such as big data, IoT, AI, and geographical information systems. So first things first is how and why monitoring matters. So according to the World Health Organization, why monitoring matters? Because according to the World Health Organization, 7 million people die each year because of air pollution, and 6 million among them are only children under the age of 15 years old. And in Africa only, dirty air leads to the premature deaths of 712 children, which is more than the toll of unsafe water, malnutrition, and unsafe sanitation. Besides, there are a lot of diseases caused by air pollution, such as lung cancer, strokes, heart disease, and lung diseases. So there are several pollutants that you probably already know about, such as carbon monoxide, sulfur dioxide, nitrogen dioxide, and black carbon. But the one that we care about the most in the More Air project is actually particulate matters. So particulate matters are very small and tiny particles. They are either solid or liquids, droplets, and are suspended in the air. And the problem with these particles is that when the level of them are high, they can penetrate deeply into the lungs and cause multiple health problems, especially for children who are much more vulnerable. So for instance, for the case of Morocco, we made a study in Rabat, capital of Morocco, and we saw the patients that were diagnosed and admitted to the emergency departments for respiratory diseases. And we found that asthma is the most actually common disease. As you can see here, 77% of patients were admitted for asthma. So how to solve this problem? The main step is air quality monitoring. And this is usually done using monitoring stations that are mostly very expensive. They cost at least $10,000 per stations, excluding installation and maintenance costs. And there are other ways. Here, for example, in Rabat, there are 29 fixed stations and 2 that are mobile stations. But the problem with these stations is that they're often placed not in urban areas where people actually live and have activities, but mostly, for example, in airports or areas that are very far from the city so that they can be safe and don't go through vandalism. So besides also, as I mentioned before, the price. Another way for air quality monitoring is pollution forecasting. So this is usually done using satellite data, but satellite data are not as accurate as measurements taken in different places. They're also used using sensors, random sensors that are sometimes not accurate or are very hard to calibrate. And then we can also add input features that impact air quality, such as meteorological features, which are the most commonly used, and traffic features. But these are not the only features that impact air quality. And of course, each country has its different sources of pollution and its different impacting features. So what makes the More Air strategy special is, first of all, its deployment strategy based on a medical survey. So we actually interacted with patients who actually suffer from air pollution, and we tried to work with them. So we collaborated with them in order to have the measurements needed. We also use a low-cost sensor node deployment. We try to cover a large area, and we take into account every studied area and the various activities and characteristics related to it. And of course, we deal in our way with the loss of data, which I'm going to present later. So for the patients and collaboration with patients, we made a medical survey in the CHU hospital in Rabat. And we interviewed 420 patients. We tried to see their way of living. We tried to understand the pollution sources around them. We tried to actually know their needs and understand them in a better way. We also, based on that, gave them sensor nodes to install in their households. And we taught them how they can actually read the measurements for air quality, and we also gave them some advices on how to avoid high pollution levels. We also know that pollution sources differ from one place to another, and even from one country to another. So, for instance, in Europe, we could find some like central heating as a problem, but in Morocco, we can find public baths, public ovens, and open street food vendors as major sources of pollution. So for that, this is a picture, for example, of the sensor nodes that we gave to the patients. It's installed in the window of the patient's house, and it measures particulate matter concentrations, PM10 and PM2.5, as well as temperature and humidity. So it's looking actually on the other way. So it measures outdoors air pollution, not indoor. And these sensor nodes were made in our laboratories within the More Air project. They are easily assembled. All components are available in the market, and it's low cost. So making the application process of the sensors are very affordable. You can see here the map of Rabat and how we installed different sensor nodes all over the city of Rabat and its outskirts. So this is indeed much better than just one big station. So that way we can measure for each neighborhood and also look into the different characteristics of each neighborhood. So we had two ways of measuring air quality. The first one, we call it the nomadic, because we put the sensor node in one household, and after a period of time, for example, 6 months or 8 months, we would take it and go into another household and give them the sensor node so that we can see the differences between different neighborhoods. So you can see here the measurements. And the second way is by actually taking the sensor nodes and having mobile campaigns. So we actually go and walk in different neighborhoods and take measurements into places that cannot be reached by car or anything. And like we walk and we measure air quality in there. So you can see here, this is a very disadvantaged neighborhood in Rabat. And this is a very advantage. The upper one at the right is very advantageous, and the Takadum is very disadvantaged. And you can see that there is much more variability of pollution in the disadvantaged neighborhood because it's for PM2.5, it's higher than 55, and PM10 is higher than 90. And this is due to different pollution sources found in these disadvantaged neighborhoods. So we inspect a lot of features found and causing this pollution in Rabat specifically, and thus also in Morocco. Or as you can see, there is meteorological features because wind and temperature and dew points, for example, they trap particulate matters and can leave them in one place for a very long time. There are traffic and road-related features. So for that part, we use Google Maps actually to get an image processing to get traffic-related features, and built-in type features and geographical features. So for the geographic features is where we include public paths, public ovens, and open street food vendors and public markets. So we define the pollution sources while we are doing our data collection campaign. So you can see here that the closest we are to the pollution source, the higher the pollution source will be. And the highest pollution sources that we found were public baths and ovens, followed by open air thrift shops, and then street vendors, and then comes traffic. While in European countries, for example, traffic seems to play a major role in impacting pollution compared to these three that we had. So for the modeling, we used three basic machine learning models. We used multiple linear regression, followed by support. Multiple linear regression is very known. It assumes a linear relationship between the explanatory variables and response variable, which in our case is air pollution. We used SVR, which is a powerful neural network-based model, and it relies on kernel functions. And we used random forest, which is one of the most popular ensemble learning techniques. Using that for the prediction in Rabat, Morocco, without actually including many features that we are planning on including later, since this is an ongoing work, random forest outperforms the other two. And we also came up with a new idea. So first we used the Air dataset just because we had much more monitoring stations, but mainly because we had a lot of pollutants. Again, as random forest gave the best performance. But the idea behind this is that because when I talked before about other pollutants, the fact that they are distributed in the atmosphere impacts actually PMs, which means that there is a correlation in the atmosphere between PMs and other gases pollutants. So we use that in our advantage, and we try to actually infer the concentration of some pollutants using those of other pollutants, which thereby will allow us to reduce the number of air pollution sensors. So we can actually use sensors of PMs to predict pollution, CO pollution or NO2 pollution without actually having a sensor for NO2 and CO. So that's the idea behind. That by using, as you can see here, traffic-related feature, by merging traffic-related features, meteorological features, and other pollutant features, we got very good accuracies, which makes our model very effective. Another thing that we need to manage is the loss of data. So you can see here that for CO, O3, PM10, and NO2, by calculating the correlation between different stations, we found that the closest they are to each other, there is something in there. So we can actually, by that, manage the loss of data by seeing that if a sensor node is working, then we just go ahead and take the measurements. But if a sensor node is not working, then we go and see the neighboring sensors and try to take the measurements from there, and there predict measurements for the sensor that is out of control. So you can see here that for this graph presentation, that the closer station here, so for one station that we took, the closer stations, we took 3 closest stations, and we predict air quality based on these 3. So based on the 3 closest stations and based on the 3 most correlated stations, we find that most 3 correlated stations give better results than the closest correlated station. So that will allow a reduction of complexity of the model by minimizing the number of stations used for prediction, and reduce the complexity of the model while showing low to no loss performance. So last but not least, all the data collected will be publicly available on the More Air website for later use for other people, whether in research or anything else, for just personal use for patients with asthma. And we can see on the website a mapping of the pollution measured, whether in one static place or in a mobile place. So that would be it for me. Thank you very much. And if you have any questions, please don't hesitate.
I was just thanking you and telling you that it was a great talk. We don't have questions yet in the chat, so please don't hesitate to ask questions. I have one question related to the very last thing you presented about the dynamic collection of data. I think you presented a situation where you had static sensors. So how do you collect data on a mobile?
Yes.
Yeah.
So we actually use the exact same sensor that we used for fixed data collection. So one that we put in a fixed position, and the other we just take it and we walk while taking data measurements, the measurements.
Okay, I see. This reminds me actually of a project that's done at EPFL a couple of years ago, where a team of researchers installed some sensors on public transportation. So I'm wondering whether maybe this is something you could explore.
Exactly, yes. We had this idea, but because the wind has a very big impact on air pollution distribution. And in public transportation, here some of them are very old, so they create pollution themselves. And also the wind impacts the measurements. While walking, there is not a lot of wind, so it's actually safer and more accurate.
Okay, thank you. And another question on my side. So how many sensors do you need to get exhaustive data for one city?
The goal is to actually do not need a lot of sensor nodes deployed, because we are going to forecast air quality for the whole city. But so far we are using almost 16 sensor nodes, and it's mainly for the patients. It's mainly to help the patients visualize air quality in their surroundings. So that's the main goal.
Okay. Thank you. And maybe one last question on my side. Did you get the chance to present your work to decision makers and help them take better decisions to improve air quality, maybe?
Not yet, but we are working on collaborations with them. We had the collaboration of public hospitals here, and because we are also very interested in the health side of the health impact side of it. And hopefully we'll also help with the management of air quality.